Hi, my name's Parisien. I'm a denturist or denture specialist who's been practicing in Windsor, Ontario for the last 14 years. Just as of this past June, I opened up my own solo practice, which is the Parisien Denture Clinic. I've taught courses all across Canada to denturists and dental technicians. I was also the second vice president for the Dentures Association of Ontario. That was about 3 years ago, before my daughter was born. It's funny how I just don't seem to have as much time since then. But I've had a couple of people ask me to put some videos together talking about dentures, giving some advice on dentures and just kind of telling people what's the deal about them. So I thought I'd start at the very beginning with what dentures are and what they can do for you. Because I have a lot of people who come into my practice who say, Barry, I don't like the way my teeth look. I want to get dentures. Or they might be having cavities popping up their teeth, and they say they're tired of fixing up their teeth every year, every couple of years, and they want to get dentures. Normally, I try to talk people out of getting dentures for as long as we can, until it's to the point where either the person's just fed up or until the time where the teeth just can't be saved anymore. Because in the end, dentures are a prosthetic replacement. They're no different than somebody who's lost an arm or a leg and that person has to start wearing a prosthetic arm or prosthetic leg. So if you could imagine having to use a prosthetic arm, you can imagine that there's going to be some things you can do like you used to, and there's going to be things that you can't do anymore like you used to, and just some things that you just can't do anymore. It's the exact same with dentures. A denture is a prosthetic replacement for something that should have been there naturally. So let's start with how dentures fit, or how they fit well in the mouth. Dentures fit well in the mouth by sitting on top of structures that don't move. So if we were to look at a model of somebody's upper jaw, now a lot of you might not be familiar with this, but this is what the mouth looks like when there are no teeth left in it. So here is the ridge where all of the natural teeth used to be at one point, and now we're just left with this kind of soft contour since it's all just the bone there. This here is the entire roof of your mouth, all right, or what we call the palate. Now, like I said, a denture fits by sitting on top of things that don't move. All of this whole ridge up here and all of your palate until we get right to the back here, and the denture sits until about right there at the edge of my finger. So we have this great big huge area that is solid, that doesn't move. And because of that fact, an upper denture gets suction and it stays in place pretty good. It works the exact same as if you have a cold glass of water on a coaster on a hot day. You put your glass down on the coaster and you have water, condensation that forms on the outside. It flows down and it rests on the coaster. So your glass is fitted up tight against the coaster. You got that liquid there. What happens when you go to lift your glass up? The coaster comes with it. A denture is the exact same. The denture fits very closely to the tissue in your mouth. We have a liquid in between. In our case, it's saliva now in the mouth. So we have two very close fitting surfaces with a liquid in between. You get suction. Exact same principle as the coaster and the glass. So that's why an upper denture will get suction to stay in place. Now, when we talk about a lower denture, and now I know to any of you who don't know what the mouth looks like without any teeth, this is an upper model, this is a lower model, okay? There's not a lot of difference if you've never really seen what you're looking at, but trust me, there is. I'll show you. Now, with a lower denture, let's talk about the things that do move as opposed to the things that don't move. So with a lower denture, right in here, this is all where your tongue would be, okay? So you have the floor of your mouth. Inside there, you have your tongue, which are always moving no matter what we're doing, speaking, chewing, swallowing, anything. You also have your cheeks on the sides, and you have your lips up in the front that are always moving no matter what we do, whether it's speaking, chewing, anything at all. So the only thing that doesn't move and that is solid is this thin ridge of bone that you see here. And if I were to take a marker, excuse me for 1 second, you can stare at the top of my head. If I were to kind of mark with a marker, I'm just going to mark off the areas that do move. So that way you can see kind of what's left over that is solid. Bear with me here, I'm almost done, at least for the inside. Now, right there, that is pretty much everything on the inside of the denture that would move, okay? On the outside, we have basically all this all the way around it. And so now, if you can get an idea, like I was saying, on what is solid in the lower denture, all you have is this thin ridge along here of bone that is solid and doesn't move. When you compare that to the upper denture, where everything up here is solid and doesn't move, there is very little area where the denture comes in contact with the gums, and there isn't enough surface area that the liquid is in contact with the denture to get suction, okay? That is why a lower denture will never get suction. It will always be able to lift up and down. You'll be able to push it up with your tongue. You can move it back and forth. The more bone you have in your lower denture, the better it will fit. It holds it in place more. There are some people, they have so little bone that the denture can literally just slide around whenever it wants, which is very unfortunate. So that is how dentures fit and why they fit the way they do. Now, with a lower denture, as you can see for why it doesn't fit well, that is really where you want to start considering having implants placed, because implants can make an absolute world of difference, especially for the lower denture. They are definitely much more money. You're dealing with a surgical procedure now, and also all of the components for the implants are definitely more costly as well. But definitely for the lower denture, definitely something to think about. So that's how dentures fit. That is basically what dentures are. They're a prosthetic replacement. And on their own, they are never going to give you back something like your natural teeth. I have a lot of people coming in and they say, hey, I can't eat this anymore. I can't chew celery. I can't chew carrots. My dentures move in my mouth. And the unfortunate reality is they're going to. Dentures aren't anchored into the bone, and they can move. Some people are able to eat apples. A lot of it has to do with, kind of like I was saying just a little while ago, about the bone support. The more bone there is in the mouth, the more stable your dentures will be. So some people can eat apples. I get people all the time telling me they're able to eat apples. Some people can't. But either way, even if you're able to eat apples with your dentures will still be able to move. So just don't get the idea that they're going to be in there to stay and never move. All right. So I hope this gives you a little insight as to what dentures are and what they can do for you. If you have any questions or any comments, please write them down below. If you have any suggestions for any other videos that you'd like to hear, also just please leave a comment and I'll try to get to it for you. Thanks a lot for watching.